Hello and welcome to Perinatal Collaborative's first Lunch and Learn. We're excited to have you here with just some housekeeping to remind you all to put yourselves on mute. And also, you do not need to turn on the video for yourself, okay? So we are going to do a real quick overview of several programs here today. And we have guests that are going to do about a 10-minute presentation on their program and how you can make referrals to their programs, eligible clients. And we also are going to have, at the end, some opportunity to answer any questions. So if you use your chat box and enter questions, we'll try to get to those at the end. We're also planning on posting these to the Perinatal Collaborative webpage as an ongoing resource. This has really come out of the feedback from our general membership meetings. We know a lot of you cannot get away from your desks at our noontime meetings, and so we really wanted to bring this accessible. All of the fabulous programs that we have here in Pierce County programs. Okay. We're getting a little feedback on that. So we're going to start with our first program. It's actually from the Tacoma-Pierce County Health Department. And I'm sorry, I don't know if I introduced myself. I'm Susan Pfeiffer, the chair of the Perinatal Collaborative. Our first presenter is going to be Robin Hansen. She's one of our dynamic duo of maternal child outreach team workers here in Pierce County. And she is going to talk about our program and also how to make referrals to that program. We'll go ahead and try that.
Okay. All right. Thank you. As Susan said, I'm Robin Hansen, and I work as part of the maternal child outreach team at the Tacoma-Pierce County Health Department. I, along with Britannia, we're a two-team program. So, as I said, I'm from the Tacoma-Pierce County Health Department, and where our mission is healthy people in healthy communities. So what do we do and what do we provide? So we do, our services are really individualized to the client. We're able to help with enrolling clients into medical through Apple Health or one of the qualified health plans. We're certified navigators, so we have access to applications to be able to help on the Washington Health Plan Finder, which is a really huge part of what we do. And it's we're really lucky to have that access to be able to help. And then also, so when we get a referral, we're always wanting to find out what the insurance coverage is, what if they are already covered. We want to know what managed care plan they may have. So that we can let them know about things that might be covered by their managed care plan. But the other thing to keep in mind too is that even when we get referrals and the client has private insurance, we are also wanting to look and encouraging the client to apply for Apple Health as a secondary insurance. A lot of times they don't know that they would be eligible. We know income guidelines are a lot higher for pregnant ladies, so we're always wanting to help with that. And then we can help find a doctor. You know, we go off of maybe they have a hospital they want to deliver at, and so then we're able to say, here's a list of doctors that deliver at this hospital, or here's a list that deliver at the other hospital. And so we're really able to help with that connection. And then we want to make sure that all ladies are connected to WIC or that they know of it. So maybe they haven't heard of it, so we'll explain it to them, and then we give them the contact information. The next thing that we can help link is with breastfeeding support. So whether we link them to the lactation support at the hospital or the WIC clinic, or virtual lactation support, or through their MSS provider, that is one of the things that we can help get them linked to. The other thing we do is we, regardless of if the mom is a smoker or not, We provide information on the quit line. And of course, if she is a smoker, we might provide some additional information, or maybe there's someone in the house that's a smoker. So we want to provide that information to all of our clients. The next thing is we can help if they're interested in childbirth classes, getting them linked to the appropriate class, and especially letting them know if they have Apple insurance to make sure they register for a class that's covered by provider one. The other thing we do, and that we really emphasize, is safe sleep. All of our clients get that information. And so we spend quite a bit of time talking about that, and making sure that we have some visual handouts that we give them, and we encourage to not only go over the information, but to review it with any other family member that might be also helping care for the child, or maybe even a child care provider. In some cases, we are able to help them get linked to a crib if they meet the criteria to get a crib, or we may refer them to whatever, if they're already connected to an agency that has access, then we would encourage that route. The next thing that we do is we are always looking at what programs the client might be eligible for. So whether it be maternity support services, we link to, they have Apple Health coverage. We link them to the program that they may choose, or if they don't have a preference, we know that there's relationships that some of the MSS providers have with some of the hospitals or medical clinics, so then we will refer them to that program so that they can get linked to maternity support services. And then, of course, the other thing that we do is also look for eligible clients that might be qualified for Nurse Family Partnership. We are linking them to that program, providing them with information and getting them connected. And we do much more. So again, it's very individualized on what the client, based on what they want. So we have a lot of different partners that we work with. So how do you connect or coordinate with other providers or clients? Once we receive the referral, we have a pretty quick turnaround time. We will then contact the client and follow up and let them know about the services that we offer. And then also we're coordinating with, once we know we're referring to, whether it be whatever program, a lot of times we're doing that soft handoff to make sure that the client gets connected. We're also following up with the client to make sure that they've heard from whatever services that we're referring to, because we want to make sure that that there's that connection. And we're able to text, so that's a nice feature, or call. So who should you refer? Well, all pregnant ladies. And of course, we prefer as early in pregnancy as possible. And so we know that we can have a bigger impact on birth outcomes the sooner we can get the client connected to services. Even though both China and I have specific geographic areas we cover, we do not turn anybody away. So we will link. And then the other thing I really want to stress is that we do not use any MSS units. We're not competing. We want to make sure they get connected. In fact, we don't even take a majority of the referrals that we get, unless it's an NFP eligible, which still that's a small number. We refer out to the MSS agencies. So we do not, we're not competing, we're wanting to make sure they get connected to your services. And so how do you refer? Well, there's a couple ways. You can go through online, and there is a link that's provided on this slide where you can send us a referral. It's a total secure site, so you don't have to worry about anybody else getting it. In fact, it comes encrypted with a code for us. You can also fax the referral and to the fax number listed. You can email a referral to the website listed on the slide, or you can call us directly or have the client call us directly. So really whatever's easiest for the client. All right, well, that's a little bit about what we do. And thank you for letting me tell you a little bit about what we do.
Thank you, Robin. Appreciate the information. And again, we'll be posting our slides up on the Perinatal Collaborative webpage shortly after the presentation. Again, I want to thank everyone for logging in for this first time and asking for any forgiveness on potential glitches. We're using Zoom platform for the first time, and we're going to be transitioning to our next speaker, who is offsite. So we're going to do some fancy technology, at least to us, in getting that transition to work. So our next speaker is going to be Linda Carlisle, talking about virtual lactation support at MultiCare.
Hi, good afternoon. I'm Melinda, and I work for MultiCare, and we at MultiCare wanted to start look at new models of care that we could support the breastfeeding moms. So to do that, we decided we would start a focus group and just see what exactly did moms want in related to breastfeeding. And so what they told us, they really wanted a convenient, easy access to care, and they wanted support, they wanted encouragement to continue breastfeeding. You know, they said, you know, breastfeeding is a lonely job and the bottle is only 5 minutes away. So they wanted to get in and see somebody when they needed care, something that fit in with their busy lifestyle as being a new parent. So with that information that we gathered from this focus group, it clearly demonstrated that it would be a benefit to have a virtual lactation program. And so we started a little over a year ago. And you know, our goal was to have a high quality program staffed with an international board certified lactation consultant, and I'm also a nurse practitioner, women's health. And we wanted to encourage the moms to breastfeed exclusively for 6 months and up to a minimum of a year or longer. Washington has a great initiation breastfeeding rate. It's like we're number 7th in the nation for initiation. It's like 89%, but sadly, by 6 months, we dropped down to the rank number 20th, and only 46% of the moms were breastfeeding. So we wanted to improve that. We also have very high, since we started the program, really high satisfaction patient scores, and they rated the convenience of the lactation visit as a 5 being the highest on a 1 to 5. We got a little bit lower on the visual image and the audio. That's just, you know, the internet. We can't really control that all the time, but the average was 4.7. So clearly it was working. It is working. Patient testimonials, one of the patients said she'd give it a 20 if she could, because it was just, she loved it. The information they got was really appreciated, and it was working. They were still breastfeeding, so it was a success, and it was a great experience. So we get a lot of good feedback. You might wonder, what is a lactation visit? And it's a face-to-face visit. It's like a Skype visit or a FaceTime visit. It's the consultant comes to you, although it's not the Skype or FaceTime, it's an Epic embedded camera, but it works like FaceTime or Skype. And as a consultant, I come to the mom. She doesn't have to come to me. There's no waiting rooms, no transportation. I get moms sometimes at work. I've had moms in their car do their visit. It's just, they're used to having this convenience and very comfortable with the internet and technology. I get asked a lot, do the patients need to be a MultiCare patient, and no, absolutely not. We provide this service to anyone in the state of Washington. There's no referrals needed. We also have translators that I can dub into the appointment if they need to. It's very easy to make an appointment. Just call this number. If they're not a MultiCare patient, the receptionist just makes them up a chart, tells them how to connect. All they need is like a phone, a tablet, a computer, anything that has a camera, and they just click onto my chart, click the camera at their appointment time, and it starts. So this is basically what I see. Here's their chart up here on the left, and then the patient on the right. And when we first started, I was like, I wonder if moms are going to feel any inhibition about, you know, pulling their shirts up for the visit, but I found they have no inhibition, and I can clearly see their breast, you know, their nipples if they're having problems with that, latch. If they have mastitis or thrush or something like going on, or low milk supply that they could benefit from a prescription, I'm able to e-fax in a prescription to whatever pharmacy they use. So they don't need to be I think we went over that. They don't need to be that, wait a minute. Oops, sorry about that. So this is what I usually see my patients with. On the left over here is, these are really common problems: latching pain, cracked nipples, clogged ducts, engorgement, mastitis, thrush, low milk supply. These are all very treatable conditions, fairly easily treated. And but these are the top reason people stopped breastfeeding, because it's just painful or it hurts and they just don't want to do it anymore. Over here I see a lot of these problems. They're not the most common, but I guess they wouldn't be seeing me if they weren't having any problems. I see a lot of tongue tie, and I have a lot of resources in the community that I can refer to if they need a lip or a tongue tie clipped. I see adoptive moms where we do inducement of lactation so they can breastfeed their adoptive child. I've also been working with a transgender person following the lactation protocol, and although I was skeptical when I started, she is actually breastfeeding happily now, and I was very surprised, but it works. So I may have more of those referrals. Hypoplastic breast seem to get missed, and as well as Raynaud's nipple pain. And you're wondering, how does this all get paid for? MultiCare will bill the insurance, and luckily, I would say 99% of the insurance do cover virtual visit. Medicaid pays for virtual lactation as of January 2018, where it was mandated. And why would you recommend a virtual lactation visit? Patients love it. They're the generation where they want that convenience to that medical advice and support. And we all know that breastfeeding babies are healthier, and moms are healthier. Babies get less sick, and in the end, we're just building a healthier community and a healthier next generation. Here's my number down here, and if you'd like any information like some RAC cards for your office, you can just email me and I'll be happy to send you some. The number right above it is the patient number that they would call them to make an appointment. So I guess since you're muted, I can't answer any questions, but thank you for having me, and that's my presentation.
Great. Thank you very much, Melinda. And again, we'll have capturing in chat box any questions that we hopefully can answer either at the end or we'll post up on our webpage.
All right.
Thank you.
Hmm.
So our next speaker, we have Brady Wilson that's going to talk. She's going to talk about some programs for infants and children. Great. Thank you. Okay. Did it go?
It went away.
Okay.
Okay. Hi, everyone. My name is Brady Wilson. I am the Early Intervention Program Manager for Pierce County, and I am responsible for ensuring early intervention services are available to and provided for all qualifying families in the county. And it's not advancing. There we go. Okay. Housed in Pierce County Human Services Department within the Developmental Disabilities Program are early intervention services. There can be some confusion or mystery around what early intervention means. So simply put, all children grow and develop in unique ways. Some of those children experience delays or disabilities associated with their development. And early intervention services are available to families of children under the age of 3 who are not developing as expected. So services are designed to build upon family strengths by providing coordination, supports, resources, and services to enhance the development of children with developmental delays and disabilities through everyday learning opportunities. Occasionally, I've heard people confuse our early intervention services with another service provided through Children's Administration with the same or similar name. So what we're talking about here is a federally mandated program through the IDEA, or Individuals with Disabilities Act, Part C. Part B covers special education services for school-age children, which many people are familiar with. Early intervention is an individualized education and/or therapy program designed based on family routines, priorities, and concerns. We conduct these services in the home or other daily settings, and it's called Natural Environment. As I mentioned, I work for Pierce County, where we manage the central referral line for anyone with concerns. We do not provide services directly for the most part. Instead, we manage contracts with 4 larger developmental agencies and 3 specialty provider agencies to support families across all of our communities. And those agencies cover a host of services: speech therapy, occupational therapy, physical therapy, specialized instruction, infant mental health, deaf, hard of hearing services, blind, visually impaired services. The list goes on. Each month, we receive approximately 125 referrals per month, and our contractors serve over 900 children and families in their homes and other natural settings. So a major tenet of early intervention services is family resources coordination. Family resources coordinator, or FRC, communicates with resources from within their agency and those that are community-based to sew a network of supports for each family. The county focuses more on systems level coordination to ensure smooth connections and build community awareness and collaboration. Some of our partners are listed here. For example, DSHS, specifically Developmental Disabilities Administration, or DDA, and Children's Administration, Department of Early Learning, which is specifically the early supports for infants and toddlers, addresses early intervention school districts, and then all of our wonderful medical providers across the full spectrum of hospitals to actual primary care facilities. Excuse me. We also maintain an advisory body called the Pierce County Interagency Coordinating Council, or PCICC, to foster a comprehensive county-wide system of accessible early intervention services and to coordinate transition of children when they age out as they turn 3. This is open to all of our community partners, and so I encourage anyone listening today who's interested to join our next meeting. It will be next week on April 4th, that's Wednesday, at 9:30 a.m. at our Soundview building, which is just next door to the health department here. So feel free to reach out for further details if you are interested. People wonder, who should I refer? Well, please just refer any child under 3 with a concern of a developmental disability or delay. A referral really doesn't hurt. Every referral results in a screening or evaluation. And even if the child's not eligible, that family will be connected with other community resources. We try really hard to create a safety net for these families. How do I refer? We also try to make it as easy as possible. Short of carrier pigeon, you are welcome to contact us in whatever way is most comfortable. You can call us at 253-798-3790. You can email us at PCFRC, so Pierce County Family Resources Coordinator, at co.pierce.wa.us. You can fax us, just your generic referral form or any kind of referral form that works for you. Or if you visit the website that's listed on the slide here, excuse me, I have a dust in my throat. If you use the website listed there, there is an online referral form that lets you just click submit at the end of it. Thank you. So again, please don't hesitate to reach out. Your referral could be life-changing. And I just wanted to share a quick testimonial from some graduated family many years ago. So it says, Tristan was one of your students 15 to 17 years ago. The help he received from you was the beginning of him becoming the amazing young man he is today. The little boy who didn't like to talk has played many lead roles in his high school musicals and plays. The little boy who didn't like to touch anything has become an excellent guitar player, even writing his own songs. The little boy who would cover his ears when music was played too loud for his liking has been a 4-year member of his high school concert choir and has been selected to sing the national anthem at his high school graduation. So thank you. All of your work with him so long ago has paid off in ways we never could have thought imagined so many years ago. Thank you.
That's great. Thank you, Brady, and how reaffirming that is to get that kind of feedback of your work. That's great. Well, continuing on our services for young children in Pierce County, we have our next speaker, and Candy Watkins from Step Ahead will be talking about her program and services offered.
Thank you, and thanks for having me today. I'm Candy Watkins. I'm the director at A Step Ahead in Pierce County, which is one of the 4 early intervention programs that Brady was speaking about. That is we're contracted by the county to provide these services. So we've been around for about 16 years. We've had the same mission statement all those 16 years. We keep plugging along, supporting families of infants and toddlers with special needs by enhancing their development and relationships, both at home and in their community. We're very much a strengths-based program, relationship-based. We serve, again, children under the age of 3 with a wide variety of diagnoses and developmental delays. As Brady mentioned, we have a wide range of services to offer families. You can read those on the slide, so I won't go over them individually. We serve the Puyallup, Bethel, Franklin, Pierce, Orting, and Eatonville school districts. So that's how the county's organizing itself, is by different service areas. So we're in that kind of southeast part of the county. Our services are very flexible. They are individualized based on the child and family needs, and they're very fluid. So anybody can refer into our program as long as it's within our service area. We have family resource coordination, which helps the family kind of navigate the system. We do a full evaluation of the child to make sure that they're eligible. Eligibility is 25% delay in any area of development. And we build an IFSP, or an individual family service plan, with each family, which will help guide the family in determining what they want to see, what outcomes they want to see once we start. And again, that's very, very fluid. So we base our services on those outcomes, and we adjust them as needed as we go along. Funding, we receive federal and state funding, school district funding, as well as we do bill insurance for therapy services. We also, not listed on here, do a variety of play groups. We have a partnership with the Children's Museum. We do an inclusive play to learn where half the children are community children and the other half are enrolled in our program as developmentally delayed. And then we have another more segregated kind of play group for just kids with developmental delays. We also do a lot of field trips in the community, trying to get parents to meet each other for parent support and to give the children some opportunities for socialization. Next slide. Thank you. In addition to our services for children with developmental delays, we have a grant-funded program that's called Boost. And this program is specifically for infants and toddlers in foster care. They do not meet the eligibility criteria for developmentally delayed. So these were kids that historically have been falling through the cracks, not having any services available to them. So these services are to support the child and the new caregiver. So again, a lot of children's administration services are really targeted towards the bio parent and remediating the bio parent. These services are really focused on helping the child overcome the trauma and to help the foster parent best meet their needs. So again, it's a home visiting service provided by an infant mental health specialist who focuses on improving the development, improving the parent-child relationship, and maintaining the child's placement. We serve about 80 children a year in that program. We serve about 600 in our Part C program. So how do we coordinate and connect? Well, I think we really enjoy partnering with all of you in the community. So I hope that if we share a client that we're able to coordinate services. So certainly with releases of information, we can share in resource coordination and service planning. All of our service providers have cell phones, email address, they text. So there's the usual great variety of ways to communicate. We are in regular communication with clinical therapists, pediatric offices, and child care centers, as well as social workers, foster placement agencies, early Head Start. So our kids tend to be involved in a lot of different services, and we do the best we can making sure that services are coordinated. So who should refer? I think Brady touched a little bit on this. In early intervention, any child under the age of 3 suspected of having a developmental delay or with a diagnosed condition which will likely result in a developmental delay, such as autism, Down syndrome, hearing loss, extreme prematurity, should be referred in for further evaluation. And in Boost, any child under the age of 3 in dependency and does not appear to have a developmental delay. We screen all those kids, so if it turns out in one direction or the other, if the child in foster care is referred to Boost and we discover that there's greater concerns about their development, we'll refer in for further evaluation. And conversely, if they get referred in for evaluation and they don't qualify, we'll refer them into Boost if they're in foster care or relative placement so that they get some type of service. Anyone can refer, but again, it's best if the parent is aware and in agreement, and I'm sure that those of you that are listening would be doing that, but just to make sure that we're not calling and a parent's not expecting our call. So if you know that they're in our service area, you can refer directly to our office at the phone number listed, the 2727. If you have any question about what area the family would fit into or what agency they should be referred into, just go ahead and refer right into Pierce County because they'll guide you to the right location. And for Boost, please call Melissa Russell, who's the program coordinator, at the number listed there, 3630570. Call for any questions. You can call any of us on this slide and we'll be happy to help you out. Thank you very much.
Great, thank you, Candy. And we'll continue with our last two presenters, continuing on with services for families with young children. We have Brandy Brown and Melina Swartha, who's presenting on early Head Start. And we're gonna work with our video camera here to see if we can get them both in the shot, and we'll hand it over. Yay.
Hello there, I'm Melina and this is Brandy, and we're both with Early Head Start home base, and we're gonna go over our slides. We are part of a Puget Sound Educational Service District, or PSESD, and our mission is success for each child and eliminate the opportunity gap by leading with racial equity. Our Early Head Start program supports each parent's role as their child's first and most important teacher.
Okay, so what do we provide? We provide fun weekly home visits. Fun weekly home visits to support parent-child interaction, parent education, and family well-being using the parents as teachers curriculum. We also provide group socialization groups, so those are play groups, where we also provide transportation if it's needed for parents. And these play groups, they consist of, singing, lots of free play, brushing teeth, family style meals, et cetera, et cetera. So lots of fun stuff. We also provide interpreters just in case families need it. We work with a very diverse population, so interpreters are always welcome at our home visits as well as play groups. We do developmental screenings and assessments, also vision and hearing screenings, and we do provide resources and referrals.
Yeah, so how do we connect and coordinate with other providers? Our agency recruits on a regular basis with other agencies and school districts that serve pregnant moms and families with infants and toddlers. We also collaborate with other service providers like early intervention at multidisciplinary meetings to support the child and the family. We are, a lot of the times we get to go to the meetings where IFSPs are discussed. So we make sure that we are collaborating with their teacher or their therapist. We also coordinate care with health providers to support the child's well-being. And we also coordinate with school districts to successfully transition our families, our children, to Head Start or ECAP, as well as developmental preschool, if that's the case.
So who should we refer? Pregnant women, so that's including teen moms and families with infants and toddlers up to 36 months. Children in the foster care, as well as kinship care, families on TANF and SSI recipients, families receiving or experiencing homelessness, children with a disability or IFSP, so that's equivalent to an IEP, just an individual learning plan for infants and toddlers, families living on limited income, so it's based on the federal poverty guidelines, and then families living in Pierce County.
Yeah, so the way that you can refer is, you can see the information here with Martha Waiters. She is takes all of our enrollment, does all of our enrollment, and applications can go to her. So please just make sure you have that number and her email as well. And I just want to add here, if you would like for us to give you applications, send you some flyers, we can get your mailing address and we can make sure that you get that information.
And here's all our information. So aside from calling Martha, you can also call Melena and me as well. And so what's best, usually call or text, but you can also email us as well. And we have that listed on the site. Thank you.
Thank you very much.
Great. Thank you to all our presenters. That was a pretty quick lap around several amazing programs. This, again, was really an opportunity for us to be a little more accessible for all of those that do serve families of young children and women who are pregnant. And we're really looking to you to provide us some feedback. Those of you that are on the line, you will be receiving, if you registered, a survey that we would like to get some feedback on how this went and what we might want to do next time. And also, if you're interested in being a presenter, we have no plans as of this minute for another one, but we really want to see if this was a good use of everyone's time going forward as the Perinatal Collaborative and how we can support this. We do have some time. If you have some questions that you would like to pose, you can type them in the chat box. We could get answers for you now while we have our presenters. I'm not, see, I also want to give thanks to Kate Phillips, Perinatal Collaborative Chair, who's Secretary, thank you, who's been working with the Zoom technology as we learn it together. And also for Chris Garling, Perinatal Collaborative Board member, for helping with the Education Committee work here. Do we have
if
any?
you have questions, you can unmute yourself. You can enter them in the chat box if you're shy. This is your opportunity to ask the experts about these programs. So please take advantage if you have questions or things that you are wondering about.
Mm. Okay, we're still learning here. We're not.
It looks like we have a question from user L Ford, and the question is for Robin. And it says, I noticed that TPCHD stated that they can give clients referrals to WIC and MSS. How are those sent and to what agencies?
So we have a referral form that once we identify who, what agency or that we're going to be referring to, we send the referral directly to whatever agency or service that the client that we're going to be referring them to.
Okay. And we'll post, as well as all the presenters, our slides and contact information will be up on the PC of PC webpage.
Are there other questions? Oh. For Early Head Start, for families that do not meet the income guidelines, do you refer them to any other programs?
So we do have, you can send the application, and we do, there's a percentage of our applications that even if they're over income, we can accept them. And I cannot remember the exact percent, but yes, you can send the application to us. And as well, we connect families with play groups that are our socialization groups that are in our area. We refer and partner with also Play to Learn from the Children's Museum, and a lot of families are looking for that socialization time. So we do try to connect them with other resources in the community.
Thank you. Any other questions?
Oh, here's a question from Apple. That might be Apple in Thurston County. If you cannot accept families, please refer them to our program, Parents as Teachers. Oh no, so maybe not Apple in Thurston County. Mm-hmm. If you cannot accept families, please refer them to our program, Parents as Teachers, which serves Pierce County and does not have any income guidelines, says Apple. Okay.
Great,
so
thank you
great
for sharing.
resource for people to know about. Thanks, Apple, for sharing that. Are there other questions? Truly, you can ask. I mean, we've got the experts in the room. Okay. And Apple says that Parents as Teachers is a home visiting program similar to Early Head Start, for those that are unfamiliar. Perhaps Apple would like to come and talk about Parents as Teachers at a future PCPC webinar.
The name of the program?
The name of the person.
Yeah, what's the name of the program?
Parents as Teachers. Any other questions?
Now is your chance. Ratanya is asking, do they have catchment areas that are limited to Tacoma? Is that a question for Early Head Start? Or Parents as Teachers?
Perhaps I can clarify. Let's see.
Okay, we're hearing a voice, but Brandy's going to answer,
Melina's gonna answer.
or Melina's going to answer.
Because we serve Pierce County.
Yeah, so our Early Head Start home base with PSESD serves in Pierce County. And we use the Parents as Teachers curriculum as part of the services we provide. That's what we use for each visit. But it's just that curriculum that it's part of our whole program.
Yes, and it's not, our program is not limited to Tacoma, it's just within Pierce County. So we are out in Puyallup, we have different visitors out there, the Bethel district. We're not in Clover Park anymore, we used to be, but we're all over. It's just within the limits of Pierce County.
Great, thank you.
Hi.
We do hear somebody, so I'm not sure who that is. Sure.
Sorry, Catherine. I wasn't sure if I was being received by everyone in there. So
You are, yes.
Just to clarify, our program Parents as Teachers is offered through the Institute for Family Development, and we do serve Pierce County, and we do have some restrictions depending on where the family is located in Pierce County. But just like Early Head Start, we're serving families using the Parents as Teachers model. We are an affiliate of that program, and we're serving families birth through 3. So anybody who's interested in receiving those services, maybe through Early Head Start, but doesn't meet those income guidelines, can receive services through us. If they live in the city of Tacoma or if they live in Lakewood, then they would definitely qualify. If they live in the outskirts of Pierce County, say Gig Harbor or Puyallup or Lake Tapps, they just have to have 2 or more risk factors. So that might be being low income, history of addiction, any 2 risk factors, and then they would qualify.
Great, thank you for clarifying.
Of course.
Great. Any other questions before we close? Got a minute or 2. I'm hearing something. No? Okay.
Okay.
All right. Well, again, thank you everyone, our presenters here today, and for those of you that logged in. Again, we'll be sending out a survey to get some feedback on how this went, any recommendations, if this was helpful. And again, if you would like to be a presenter as we look forward and if this was indeed serving the needs of all of our providers in Pierce County. So with that, again, I want to thank everyone, and we are really looking forward to some feedback on how we might do this, improve it, or continue doing what we've done. And again, this is a new platform for us using Zoom and sharing information in this way. So look forward to notification of Perinatal Collaborative. Our next meeting will be June 11th. We don't have we're real close to getting a confirmed speaker. So look to that announcement in the near future. So again, thank you everyone for participating. I hope you have a great rest of your day. Bye.
Maybe. Well,
Okay,
12:50
nice.
exactly. Wow.
Yeah.
I feel like I didn't
Guys,
say
when I run a show-
everything. I could have said more.
Oh,
I
yeah.
felt like well, you only had so much
No.
time.
But
So
then,
yeah,
yeah.
but it was time. It was time. You were very efficient with what you said.